Dr. Hunt has been working with concussions almost probably longer than has been recognized as a serious injury. Aside from being a surgeon, he's probably one of the resident experts in concussions, and I thought that it would be valuable for him to share his experiences with you, because we are a sport that unfortunately people go down going hard and bang their heads from time to time. And I think, one, we're live streaming it right now, and so a lot of people are watching from outside this room. And Dr. Hunt, please.
Good morning. Thank you very much for inviting me to come and speak to you. Before we get started, I want you all to appreciate that if you go on the web and you look for www.thinkfirst.ca, and then you look under safety info and then scroll down, there's a whole section on concussion. And in that section on concussion, in the Think First web, there is the Zurich consensus statement on management of concussion, and it's a must read for all trainers and coaches, and it will be in far more detail and more eloquent than what I can present today. But my main reason for speaking is just to try and get your interest and to bring you up to date on some of the new thoughts. So we start by saying a little known fact. The first testicular guard cup was used in hockey in 1874, and the first helmet was used in 1974. And it took 100 years for men to realize that the brain is also important. What is concussion? Well, it's trauma-induced. It's a shaking and jarring of the brain. And the alteration in mental status, the transient loss of awareness may be so fleeting that it's often it goes unrecognized. And as far as the need to have the person lose consciousness in order to have a diagnosis of concussion, no. Most concussions occur without any loss of consciousness. Now, concussion is a traumatic brain injury, no doubt about it. Now, sports concussion, we recognize this on the lesser end of the scale, but it's still a brain concussion. I mean, it's still a brain injury. And so, people like myself who are asked about boxing, I say, well, why would you have a sport where the whole purpose is to produce brain injury to the other person? It doesn't make sense. So anyway, I'll leave that, I'll get off my box right now on that one. So, it comes down to you don't need to be unconscious like Bart here. But if there is a period of unconsciousness, or if there's a suspicion that the person's had a concussion and they are symptomatic, they need to be seen and assessed by a medical doctor. Concussion, you don't need to strike the head. It's the shaking and jarring of the brain. So whiplash phenomenon is often the case where concussion occurs. And so often in motor vehicle accidents and rear-end collisions and so on, people suffer a degree of concussion and it's totally unrecognized. Now, I agree that the back of the head can strike the headrest, but essentially you don't need to strike the head. It can be, the impulse can be transmitted to the brain by a shaking and jarring of the body and the head. So we have experiments, right? And we have rats that we bump in the head, and you can monitor the temperature of the brain, and the temperature drops while the rat or mouse is symptomatic. And they were trained to go through a maze, and then during their concussive phase, they're lying there or they can't find their way through the maze. So we do have that situation where we know the temperature drops while the animal is symptomatic. Now, why is this? And we don't know what concussion is, but my hypothesis would be that if we are dealing with a metabolic problem during the transient phase that the person is concussed, then likely the problem is at the synaptic junction, because that's an electrical chemical function, that's a metabolic function, that's a heat-producing activity. So it's likely that there's a problem at the synaptic junction. I'll leave that. Now, the whole purpose of, the whole reason for thinking about this is that it's because we don't understand concussion, and in most cases, if not, well, in all cases of CT scanning, it's normal. All right, the CT scan is normal because the problem is at, again, the electrical chemical level, or at a level that is below the resolution well below the resolution of a CT scan. Likewise, an MRI scan. Now, this is an abnormal MRI scan, but I just wanted to bring up the fact that with a regular MRI scan, it will be normal. We are advancing our techniques, and we're becoming more sophisticated, so there's now a mean diffusivity or something of this sort that we're working on that will show abnormal changes in the MRI when a person has had a concussion. But again, this is early on, and it's more in an experimental sort of situation. But advances are being made. For the sake of the argument, as CT scans and MRI scans don't show the abnormality. What will show the abnormality in a person that's symptomatic are functional studies where you can take the MRI scan and use what we call a functional MRI scan, where there's a measurement of the uptake of oxygen, and we can measure that, and we can see that that person is not back to normal. And again, Karen Johnson back east has often said that, you know, with elite athletes, it's important that we have a method of finding out whether they're still symptomatic or not, because they'll lie through their teeth in order to get back into the game. And but she's always said that if a person is honest and will report their symptoms, that when they're asymptomatic, their functional MRI scan is normal. So if you can trust your athlete to be honest and open and monitoring their symptoms and being sensible, then you can follow their symptom and they'll let you know when they're ready to return to contact sport. And this is an example of a PET scan. Again, this is a metabolic measurement, and that's one way we can measure a function of the brain in people that are symptomatic but who have a routine, regular, normal CT and regular MRI scan. Now, the whole basis of bringing people off the field when you suspect that they've had a concussion is to monitor them for a period of time, because often it's identified that in athletes particularly, they'll function normally for a number of minutes and then they'll become confused. And so it's important that when you suspect that somebody's had a concussion, you bring them off the field and the sports arena, and you monitor them. Now, a prime example was, and again, this brings down the importance of teaching our athletes what I'm talking to you today about. Because in Val d'Isere, a number of years ago, I was with the coaches, and one of the men skiers fell above us. And there was a delay, and then he finally skied down to us, and they said, "What happened?" He said, "Oh, I crashed, but I'm okay." And they said, "Okay, back to the hotel, and training runs are over for the day." And he skied down. I was called over to the hotel about 3 or 4 hours later at supper time, or just after supper time. He was totally confused. He was gibbering his language, and he had no idea how he got off the mountain. And so again, if you suspect that an athlete's being concussed, they need to be monitored and they need to be watched. You cannot just say, "Okay, fine, you make your way home." Now, what's going on with the concussion? Well, there's a difference in genetics. This is a bummer of a birthmark, Val. That's what this says. And the point is that there's a variation in all of us regarding our ability to withstand shaking and jarring of the brain and head. And I suspect, and this one said, I like recess a lot better before safety helmets. And I use this slide, and a number of my slides don't make a lot of sense, but they're triggering me what to say. That I think in years to come, we will be able to do DNA testing on children, and we'll be able to determine which of the children are reasonable to allow them into contact sports, and which other children that are susceptible will be geared or pointed towards non-contact sporting and activity. So, what is going on with concussion? Well, we now know, usually we were taught when I went through school that concussion was a totally reversible thing without any permanent brain changes or brain damage. Well, this is wrong. We now know that there's an accumulative effect. We don't understand it. It varies amongst genetic. It varies the degree of how many concussions the person's had and so on. But they are accumulative. So eventually, the Simon Fraser University researchers have talked about a safety margin, a margin above which, beyond which you'll become very easily symptomatic. And I suspect that the Lindros brothers are a prime example where they just have to skate down the ice and have a little bit of sideboarding and they develop a headache. And so that's an example of where there have been so many situations where this person is now well beyond their safety margin, and they should be discouraged from continuing with contact sports. What are the clinical domains? Well, symptoms, physical signs, behavioral changes, really important, cognitive impairment, and sleep disturbance. Now, generally, when we talk about sleep disturbance, we talk about reversal, where the concussed individual who's recovering is unable to sleep at night and then is drowsy and fatigued all day. But the other thing that, the other reason I want to say this, that for those of you who have children, we were taught years ago that it was important that if somebody was concussed, you had to wake them up every couple of hours. How are we doing, Bruce?
Sorry, there's people that are watching online, something's reflecting and they had difficult time seeing, so I was going to try to help you. So just carry on.
Okay, carry on. All right. So my plea to you is that if you have a child, or you have an athlete, whatever, who's had a concussion, for God's sake, let them sleep. But what you do is you go into their room, open up the door, and look in them and look at them. And if they're lying comfortably in a nice fetal position, their color is good, their breathing is regular, let them sleep. Because you know, by the time you wake them every 2 hours, the whole family's in a disaster the following morning. So this is one of the things that I really make a point. So the most commonest symptom with a concussion is headache. And actually, this is quite nice because 85% at least of concussed people experience headache. Obviously, about 15% don't. But if they do have headache, it's one of the best ways we have of monitoring how they're doing in their recovery phase. Because if they start to exert themselves and so on, and the headache comes back, then you know that you've got to back off. And so a headache is a very nice way of sort of monitoring recovery. So again, back to the physical signs, symptoms, and behavioral changes. And these are some of the symptoms of concussion. And if you look at their sleep disturbance there, poor concentration, headache, dizziness, all of this that you will find on your cards, and also when you look at the consensus statement from Zurich, they've listed all the symptoms. But the most important thing I want to show, to make a point, is the emotional and personality changes and mental depression. And of course, we all know what's happened this past summer with 3 hockey players having difficulties. And mental depression is a key, one of the key symptoms that following with ongoing symptoms of concussion. So again, the signs now, poor balance and coordination. You would suspect that this was okay. You would suspect that balance and coordination, that's got to be cerebellar. No. Matter of fact, frontal lobe dysfunction can produce significant imbalance difficulties. As a matter of fact, the old neurosurgeons in the old days that have no way of finding out what was going on, if somebody came with an imbalance, they either had a hole put in the front of their head or a hole put in the back of their head in order to try and find the problem. But anyway, just to mention again, the unusual emotions and personality, and you say, well, why are most of the symptoms and signs of concussion, why is it frontal lobe dysfunction? And I don't know the answer, but if you think about it, the frontal lobes, particularly the cortex of the frontal lobe, is the furthest distance away from the brain stem, so there's more likely a torsional effect. And the other thing is that there's more likely because it's the further distance, there'll be probably more synaptic junctions that get involved. I'm not certain, but it is fascinating that a number of the dysfunctions in a concussed individual are frontal lobe dysfunctions. So we don't need rats and mice. We have football players. We have hockey players. We can do testing of them before the season, and then every time they're concussed, we can do further testing of their cognitive function and so on. And we can monitor human beings now, which are far more reliable than a rat or mouse. But it's kind of fascinating that a study that was done a number of years ago was they took all the high school kids that were playing football, and they taught them and discussed with them what they were looking for. And they said, we're going to talk about if you're a frontline football player, whatever, and you have a ding. Now, football players, everybody knows what a ding is, sort of. So that's when you sort of get bumped and you see stars for a second, and then you're okay. And so they tested these football players at the beginning of the season, and each time the player came off the field and said, I got dinged. Then what they would do is they would monitor their cognitive function. And they found that without any symptoms, that the football player didn't have any symptoms, no headache, nothing, just that they reported that they had a ding, that it took 48 hours for their brain function to return to baseline function. So obviously something's going on. And it's subtle, and it's hard to manage, it's hard to identify, but but we need to pay attention to to all our young athletes that are in contact sports. We no longer use grades of concussion. The doctors, the world's the experts could never agree on what a proper grade was, so we don't talk about ding and so on. We now monitor and determine the severity of concussion in a retrospective manner. In other words, how many symptoms did they suffer, and how long did they suffer those symptoms? And that's how we now determine the seriousness of the concussion. And we no longer use the word, at least I don't, and a number of other people don't use the word syndrome anymore. It's all concussion. Okay, and so if you're still having persisting symptoms of dizziness, unsteadiness, and fatigue and so on, and visual disturbance and inappropriate behavior, that's still all considered part of the concussion complex and no longer includes a syndrome. Now look at number 12, denial of injury. You cannot believe the number of times, and it's not just the elite athletes that have, that are worried about their sponsorship and so on. It's fascinating the number of people that fall or in a motor vehicle accident and so on, and they immediately deny, no, I'm fine, I'm okay. And a lot of it's just embarrassment, or they just want to get out of there. They just want to get away from the situation, and so they deny that they've been hurt. Symptomatic concussed athletes have a 6 times likelihood that they're going to have a repeat concussion. You say, well, why is this? Well, let's face it, the coordination is altered, their timing, everything's wrong. So a hockey player, for instance, will keep their head down a bit more, so they're more likely to be hit. And when you're talking about downhill racers that are going at ski racers that are at high speeds, it only takes a very subtle difference for them to lose an edge and go into the nets and hurt themselves. And the problem is that when you have had a concussion and you're not better, you're still symptomatic, and you have another significant head shaking and jarring event superimposed on the first one, then there is the potential of 8 times brain injury and permanent changes. So that's why it's so important that we recognize when we believe an athlete's had a concussion. And that's why we need to educate the athletes so that they know what we're looking for and they can report it. Now, the fascinating thing about a concussion is that with exertion, we have found that their symptoms increase or remain, initially it was exertion, and that the symptoms persist, and that the symptoms can increase. Often I'm asked in court, what do you mean? Concussion, you're supposed to get, generally better. No, there are reasons why people actually, their symptoms increase following a concussion. The fascinating thing is the mental aspect. And so often people who are at work and so on, or have a mental job, having to use their brains, cognitive function and so on, and they're forced back before they're ready, they get a persisting of their symptoms and sometimes an increase in their symptoms. So one of the fascinating things I found was that often I've been called, or not often, but occasionally called from Europe, and one of the skiers has had a bad crash, and they're having some symptoms of headache, dizziness, and so on. And the question to me posed by phone is, should so-and-so return to Canada? And of course, this happened a number of years ago, and I said, no, let the so-and-so stay there and follow to the next venue and so on, but no training and resting, okay? And so I get a phone call a week later, and they say, not any better, he's actually worse. And so he said, well, what's going on here? Well, what are they doing? Well, he's in the hotel, and he's watching movies, he's playing video games, he's doing his homework and his computer work, and so on. And so you find that it's what I discovered was that if the moving type of situation where there's a screen in front of them tends to keep the symptoms longer. And you remember Dave Dixon, he wasn't getting better and so on, and we had to find out what. And he was watching the movies from the previous game and helping the coach that way. Once we stopped him looking at those game movies, he got better. So this is something to remember with all our kids now that are using computers and so on for their education. Is there anything that we can do to speed up recovery from concussion? Well, I don't know, but my belief is that having monitored some of the high-end ski racers and so on, a number of them have had very good coaching in meditation techniques for enhancement of their sporting performance. And I found that if they used the meditation techniques when they were still symptomatic, there seemed to be an acceleration of improvement and a resolution of their symptoms at a faster rate. And so I've been telling people for the last number of years, and it's amazing the number of people I've run into, and they say, you know, when you told me to meditate, geez, I started to get better. I wasn't getting better at all. So I'm not talking about a monk and 1,000 candles and incense and all that crap. I'm just talking about lying in bed and resting back and concentrating and breathing and all the techniques that are used just for relaxation. Probably 2-3 times a day for 20 minutes seems to be a help. Now this says say no to crack. And I use this slide to remind everybody that alcohol, marijuana, and street drugs and so on, they don't help matters. They actually will delay recovery from a concussion. But the other thing to remember is that many of our athletes, when they are concussed, they have other injuries, limb injuries, whatever. And so the physicians place them on anti-inflammatories, they place them on analgesics for pain relief and so on. Those have to be discontinued before the athlete starts to return back to their sport. Because they're going to have a stepwise return to sport, which you'll find on your cards, and which you're going to read, and which I'm going to show you. And so you do not start them back until the medication is off. Because otherwise the medication is masking the symptoms of concussion at the same time. There are 6 stages. This is the ZERT conference. Their consensus statement, and again, one of the interesting things is in the 6 stages, it says no activity. Well, I'm telling you, you take a high-end athlete and tell them not to do anything, you're asking for trouble. They just go bananas. They're anxious, they want to maintain their conditioning, and so on. So, of course, it makes sense maybe for the first 24, 48 hours that they not do anything. But if you're monitoring them as a trainer and the coach and so on, yes, let them start back doing something, even going for a little walk or something, so that they feel that they're doing something and that they're contributing to getting better. Because to ask a high-end type A personality to do nothing is just increases the anxiety, and that's where I often say in court why individuals actually get worse, because they become anxious and they start to focus on their situation, they start to ruminate, and their symptoms just compound, and mental depression sets in. So I'm not going to spend too much time on the stages. It's just the whole purpose of it is to work at each stage, and you don't advance to the next one until you're symptom-free. In other words, light aerobic activity, you start to do it, you get a headache, and you back off, and so on. But in an individual that's had a concussion and is without symptoms, they still have to go through the 6 stages. And the minimum time for each stage is 1 day. So we're really talking about a full week, really, before the person should be placed at risk again for hitting their head, even though they remain asymptomatic throughout all stages of recovery. And stages 3 and 4, now after stage 4, once they finish stage 4, the more complex drills and so on, that's when they see the doctor and get the clearance. Okay, they don't go on to stage 5 and then back to also as the stage 6, the normal gameplay. They don't go on to stage 5 until they've had clearance of the doctor. All right. Now the problem being is that do our doctors understand what I'm talking about? Well, unfortunately, it's an education program, not just a process, not just for you, but for the medical fraternity, because much of what I say today isn't really understood by a lot of my colleagues. You will find the SCAT-2, the Sports Concussion Assessment Tool. It's a very good tool for assessing your athlete and the recovery. The problem is that many family physicians who want to use this, or sports people, in trying to assess the athlete, the balance testing and so on takes a considerable length of time. Now, I realize that there's a sideline assessment that we talk about, but my point is that yes, you want to assess the athlete if they've had a concussion, at the sideline. But if you believe they've had a concussion, they do not go back. In other words, a sideline assessment is not for the purpose of saying, okay, I know you had a concussion, you certainly bumped your head, you saw stars, but you're okay, I'm going to send you back in the game today. No, you don't race the same day. So it's a whole basis of concussion education for you and for the athletes. Athletes need to buy into what we're saying. We have to teach them that every brain cell is important if they want to be the next best. And if they're not caring for their concussions and they're shaking and jarring their brain and they're having persisting symptoms, they're not doing themselves any good at all, and they certainly won't achieve the level of competitiveness that they want. So this is the education we have to say. And in the United States, you know, there have been some very unfortunate things, so that just south of the border here in Washington State, they've made a mandate and they want it throughout the United States, and it was actually Washington that said, one, the player doesn't go back in the game and has to be cleared by a medical professional, and they actually made it a law. The House bill was passed in Washington, making it a law. So you can see now that we're starting to get into a situation that if we're not paying attention, there may be a degree of liability here for all of us if we don't know what we're doing and handling the athletes appropriately. A couple of years ago, I know Don Cherry's in trouble right now for various reasons, but you know, a couple of years ago in our concussion committee, I was asked what would be the best injury prevention thing I could think of, and I said, put a bullet through Don Cherry's head. Now, in all fairness, I have the other picture, and there he is, God bless him, commenting or showing that, you know, we don't want any back checking in hockey. So I'll leave Don there. So we not only equip our athletes with the best equipment, but we educate them, teach them, and one thing we can do to reduce the risk is to strengthen the neck muscles, and the boxers have learned this long ago by making the boxers take massive neck muscles, and so the head, the receiving mass of the blow is dissipated by the enlargement of the muscles and all, you know, with the head. And it also, again, you reduce the degree of shaking and jarring with good, strong neck muscles. Now, what about you know, there's often said that by wearing a proper fitting mouth guard that you can reduce the degree of concussion. I don't know, but I think, first of all, a lot of the kids have spent a fortune on their teeth, so it's important to protect the teeth. I think there's a hypothetical basis to it in a way that if you have a good fitting mouth guard, and I guess some of our downhill athletes and so on are having trouble breathing through them, so there's got to be a really good airway. But if they're clenching their jaws, what they're essentially doing is increasing the mass of their head. And of course, physics tells us that the larger the receiving mass, the more dissipated the energy is directed to each part, and therefore diminished pressure, diminished shaking and jarring, or kinetic energy, diminished kinetic energy directed to the brain. A good fitting, a well-developed and designed helmet, properly worn, does not prevent concussion. What it will do is reduce the degree, but it won't necessarily prevent concussion. And obviously it won't prevent death. If you're wearing a nice helmet perfectly and you run into a tree at 70 miles an hour, there's just no way the helmet's going to help. But we still believe that it's appropriate that the helmets be properly worn and designed. And this will reduce there'll be an absorption of some of the kinetic energy directed away from the brain. Just an example of a helmet that is inadequate is our friend here, Goretzky, and one of my patients had a helmet, and in a warm-up up at Hollyburn Country Club was hit on the side of the head by a puck. And if you look how I've done it, you can see that how the helmet is imploded by me pushing on it. And there's his CT scan with a skull fracture and over his speech center, and he had some minor permanent changes of speech. Now, again, that's not concussion, but I'm just talking about inadequate helmets. This little girl probably got an adequate helmet and had the actress in Quebec been wearing a helmet, she would have been concussed, but she wouldn't have had a fractured skull and an epidural and died. So helmets are helpful and useful. And so, again, it brings, this slide is just to remind everybody about that we all have an obligation. I'm not trying to scare you, but I think I want you to be knowledgeable, and I want you to monitor your athletes in an appropriate fashion. Now, maybe what I'm saying today will be bullshit, 5 years from now. There'll be a whole new outlook on it, but it's the best we have right now is following the Zurich consensus. And there'll be a new conference regarding sports concussion next year, and there'll be some new developments. Just remember that your athletes to and from the venues are in vehicles. Airbags cause concussion and head injury, and it's usually unrecognized. So, and if any of the athletes have been, not in this degree of an accident, but if they've been in an accident and so on, and so this brings up the other thing is, if you're as ski coaches and so on, you're interested in your athlete in your discipline, but always remember that these athletes are doing a number of other activities. And certainly if any of you have children, there's multiple things that happen to a child in a daytime and on the weekends in the terrain parks and the mountain and skateboard parks and so on. So pay attention to all the activities that your athlete is doing and the degree of shaking and jarring their activities are bringing to them. And again, please take the liberty to pass it on, the message. And again, I'm not trying to frighten everybody, but I just want everybody to realize that we are different, and that we need to monitor each individual and monitor their various falls and keep track of what's going on during their career. And again, www.thinkfirst.ca under safety info, and then scroll down to concussion. Thank you very much.
Thank you. Thank you, Dr. Hunt, but I have a question, and I know you've answered it before. Our provincial ski team and a number of the clubs use the impact test as a mandatory test for baseline. Would you like to comment on that and its value?
Yeah. I think that all these cognitive testing is a worthwhile endeavor, but you cannot accept it as absolute. Some of the athletes have often told me that they can, in quotes, cheat, fudge results, whatever. I still believe that educating your athlete, insisting the seriousness of what we're talking about is going to be as much of a help as following them with the cognitive testing. But I do support it.
Okay. Because yeah, we had it mandatory in our provincial team, and have used it from time to time, and it's just another tool.
Yeah. Yeah. It's just, that's right. It's all part of and again, well, that's right. It's a tool, but I just think we need to be honest, all of us. Somebody had a question. Yes.
This is a follow-up to Bruce's question. Is there a movement within the medical profession to get the medical practitioners more aware of the cognitive testings? And why I ask that after one of my daughter's concussions, our family doctor was unaware of the impact test, for example.
Yes, there definitely is a movement afoot. I've been speaking at conferences. The BC Medical Association is pushing it. And Think First, with the help of the BC Injury Prevention Unit and the government, are on the basis of getting a program out to all the physicians. In the near future, it's being developed. So yes, because again, my plea to them is ignorance is not acceptable, and you will be sued by a parent if you don't care to monitor the athlete and instruct the athlete and their parents appropriately. There's going to be lawsuits. Yes.
So I have a question among yours. So you mentioned that they're not helping concussion, or
Mouthguard. Okay, fire. Yes.
Do they help or no? I'm just wondering what is suggested.
Yeah. I don't think, I'll put it this way, I don't think we have any absolute research that says they help. But from a hypothetical point of view, I believe if it's properly tight, that you're increasing the mass and diminishing the energy directed to the brain. But that's only a hypothesis.
Okay.
I mean, the dentists talk about by tightening up the mandible, you're therefore decreasing the likelihood of it striking the temporal fossa and impacting impulse to the brain. That's the dentist's point of view.
Yeah.
I don't know that, but
This is what they suggest actually, so.
yeah. No, but I still think it's important, but I can't say how much it helps
Okay.
in prevention of concussion. Yes.
Do you think it's just knowledge and education that in 10 years' time, the treatment of the Lindros brothers and the treatment of Sidney Crosby and the media with their coaching, with the professionals, it's just because of education over the last 10 years? You know?
Well, there's been a major shift, and I agree that I believe that as we keep educating, we keep learning more about concussion, we keep paying attention to it, that there'll be major changes in all sports. But again, I'm not opposed to contact sport. I don't want you to think that I think everybody should be wrapping cotton bat. I believe in contact sport, but I also believe that you should be monitoring. For instance, how many of you have children, or how many of our athletes here, our racers, enjoy soccer? A whole pile. So what the question is, do you head the ball in soccer? The answer is, of course you do. All right? Does everybody head the ball? Well, maybe not. And the way to do it is that you start off with a youngster and you work with a very soft ball and you start to teach them the right technique, but you ask them, how do you feel about this? Does this trouble you in any way? Pay attention to them. Instead of the father saying, oh, you wimp, get the hell back in there. You know? I'm sorry. So we start paying attention. Asking the kids, how do you feel about this? I mean, you know, it's the same with, if you watch the youngsters in hockey now, and they started them off, you know, the CBC did a whole series on young hockey players and whether or not they should be hitting and boarding. And there were the injury rates went up. And the movies were showing the kids lying on the ice, and some of them had, you know, broken bones and whatever. But nobody commented on the fact that the kid lay in the ice for 5-10 seconds and didn't move. They all missed the whole fact that the kid had also had a concussion. They were all concentrating on bruises and broken bones and stuff, forgetting about the brain. Yes?
Could you talk a little bit more about the emotional impact, like the depression that's associated with concussion and the long-term effects of that?
Sorry, I'm quite definite about my hearing aids in. Yeah.
Can you talk
They're
about,
useless, of course. But
can you talk about the long-term effects on mental health, like depression in the long term?
okay, well, in athletes or in general?
Yeah, athletes who experience concussion.
Oh, well, I think I believe that when we fail to recognize that the athletes had a concussion, and we encourage them to return to their sport, and we're not paying attention to them, I think that if you go, and then mental depression shows up, and they're just not getting over it. I think if you go back, you realize that, well, we missed the ball, we dropped the ball. We didn't immediately address the situation of this person having a concussion, getting into some anxiety problems, maybe a little bit of early depression, and they could have at that point been put over to a clinical neuropsychologist. They could have gone to the psychologist, and this could have been all sort of worked on and sorted out, and rather than ignoring it and having the person trying to carry on. You know, and I believe that a lot of the depression that we see in athletes that have had repetitive concussions is based on frustration that they know they're not quite right, and they're not quite achieving the level of expertise in their sport that they know they can do. And there's a frustration builds in, and then a depression, and so on. I think it's all connected. Does that answer?
Yeah, so it's not the physiological effects of a concussion, it's the
Well, now, does everybody hear what she's saying? This is fascinating because I'm having to deal with this often again in court. And that is that, when you have a head injury, a concussion, a mild traumatic brain injury, and it's not dealt with and recognized. For instance, the person goes to the family doctor and says, I've got this headache, and I'm not feeling well, and I'm not sleeping. And the doctor is giving them pills and not directing them to the psychologist where they should go. Then anxiety develops, and then the whole symptom complex of emotional difficulties and depression and so on just snowball. So it's important that we, as they say, what are we doing to teach the physicians of what I'm saying today? And we're working on it. We're trying to get family doctors to understand that concussion has to be dealt with, has to be recognized, and the person has to get suitable support and care, and not told, look, there's nothing wrong with you. Repeatedly, you hear it from patients over and over again. The doctor said there was nothing wrong with me.
Is there a window of successful treatment? What happens if it's left unattended for a long period of time, a year, 2, 3?
So the question is, if we ignore it and is there a problem that'll never get better? And the answer, my experience is that the longer the person goes without proper treatment and recognition, the more difficult it is for them to recover. And so the earlier the diagnosis, the earlier the intervention, albeit whatever, the better the result. But again, it's an additive effect. So your athletes are repetitive shaking and jarring their brain and head in their activities, and you've got to be paying attention. Is this person able to tolerate this, or should we be saying enough's enough? Yes.
I have one more question. Just happened 2 weeks ago actually. One girl fell last day before we traveled, and she was kind of showing some symptoms, but in the end was nothing. But we couldn't find the answer. Could you travel on the plane after you have a concussion or no? Or what's our suggestions for?
Okay, so the question is, after concussion, should the athlete be traveling? What we're trying to do is to reduce physical exertion and stress, mental stress and so on. And the way the airports are right now, it's stressful, bloody stressful. Now, fortunately, most of this, your ski team people, they're really sort of ushered through. I mean, when I went with the team, it was great. We just got first-class service, sort of. But I guess that's changed now. But so if you think that the journey is going to be a stressful one, and it's a long one, best they not go, because you want them to relax, rest, and recover, and then travel. But if they're managing and they're recovering and the symptoms are settling, and you think this, then yes, let them travel. There's nothing wrong with their, actual. You'd say, well, you're up at what, 5,000 feet in the air cabin atmosphere. Is there lack of oxygen, whatever? Does this make a difference? I don't know the answer to that. Is that what you're getting at?
Yeah, we got kind of a few answers that the pressure is the same that I read over the internet, and was kind of the answers were similar. But I was just if there are any guidance.
Yeah, I haven't read up on that, and I don't know for sure. Okay, everybody had enough? Too much? Anyway, thank you very much. Thank you.
Thank you, Dr. Hunt. And on behalf of BC Alpine, you have a red one, and now you have a black one.
Oh, beautiful.
And please stay for lunch, because you guys, we're a little ahead of schedule. Lunch is going to be ready in 5 minutes. We'll probably meet a little earlier because we still have some reporting to do back from our previous engagement. So take a 5-minute break, and then we'll have, I think we can have lunch as opposed to breaking at 15 minutes. So thank you, Dr. Hunt, again, and have some lunch with us. And if anybody has any more specific questions, we can stay for lunch. Dr. Hunt, stay for lunch so you can chat with us.